Hello, everyone, and welcome to Heads Up, the weekly podcast and webcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I'm here today with someone we all know and love. This is Shirley Kessel. She's the executive director of Miles for Migraine, those awesome migraine runs that we have so much fun being involved in. So, hello, Shirley. How are you today?
Hi, Lindsay. Good to see you.
Good to see you. Thanks for being back here with us today.
Thank you for having me.
So, we have Shirley here today for a really fun, awesome topic that I hope everyone enjoys. It is almost Mother's Day, and we wanted to record on being a mom with migraine and on being a mom who takes care of kids or raise children who also have migraine. There are so many of us out there in this boat, and I wanted just to encourage everyone and just chat about this topic a little bit. We're just going to have a really casual, open conversation about it. I'm in this boat. Shirley's in this boat. We are in different stages. I have young children, very small kids. Shirley has teenagers or older children. So let's just start talking about this topic, and I hope everyone enjoys what we have to say about it. So Shirley, let's just go ahead and get started. You come from a family where there is sort of a multi-generational situation where migraine showed up in your family.
Yes, that's correct. And I had a mother who had severe debilitating migraine. And from the day I was born, I just remember as a very young child standing by her bedside when she would actually go into that dark cave for 4 days at a time, vomiting and completely out of control. And so I developed migraine myself, and no one diagnosed me because my mother just never talked about it. We just saw my mother up in her bed, and we just knew that she was in bed with her migraine, and we just went about our daily life. And so, when I started having migraine attacks, I had no idea that's what they were. My mother never picked up on it either. And then consequently, I had 3 good daughters, and 2 of them inherited migraine.
Mm-hmm. I can relate to that. I got mine from my father, and he had what seemed to be, constant headaches, and his were diagnosed as sinus headaches back then because that was just what they always called them. And so when I had them from the time I don't ever remember not having them. I thought it was normal. I thought that was the way everyone was. So I do think there's a component of that in families like ours where it's just normal. Why go to the doctor? So
Yes, absolutely.
Right.
And I never even put 2 and 2 together. And my mother said, "Here, take some Tylenol." Huh. If someone said that to someone now, they would look at you like, "What are you, crazy? Tylenol for migraine?" We know that doesn't work.
Right. So I wanted to ask you about something that I really think is such an important thing to talk about. Your children, when they were babies, they had colic, which is very common in our families with migraine. It is believed that there is a common genetic component to migraine and colic, which can be very difficult on moms, especially if you're a mom who's dealing with migraine and then you have a baby with colic and then you're worried about your baby. And it is obviously difficult to take care of a baby with colic. So I think there's some moms out there that have been through this and would love to hear about it.
Yes. Wow. It was just a total game changer. I just became a grandmother a couple months ago, and thank you. My daughter had a daughter, and this little baby is the ultimate perfect child. She just cries when she's hungry, and then she stops crying. So my experience as a new mother was completely the opposite. Every night, like clockwork, it would turn on at around dinner time, which is common for children with colic to do. They would just start wailing. And it went on for hours. And I can remember even putting them in the car and driving them around. I think, unfortunately, I don't really know what is what resources are available for mothers with kids that are experiencing colic. But I think it's important to know, to report this to the healthcare provider, to let them know that, you're having this experience with your child, and could it be migraine?
Mm-hmm.
And I wish I would have known that. So maybe when my middle daughter had symptoms as a young girl of age 12, I had no idea that she was having migraine. And I was giving her Tylenol and never took her to a physician to be checked. So I think it's a good red flag. Pay attention to.
Right. And I do think these moms just need so much support. I mean, especially, I can't even imagine if you have migraine attacks yourself and you're taking care of a baby who's
Yes.
crying all the time. I can't imagine that situation. So, how old were your kids when they were diagnosed with migraine?
I guess they were infants, right? Well, my oldest daughter did not inherit migraine, and my other two did. My middle she started having migraine symptoms at 11, but wasn't diagnosed then. And then my youngest was diagnosed at 16. She was diagnosed with new daily persistent headache. And then it became apparent to me that my other daughter had migraine. I had no clue. And I was having, just menstrual migraine throughout my childbearing years.
Mm-hmm.
And, but I had been chronic when I was in my early 20s. And the doctor said to me, well, I was engaged at the time, and he said, well, just have a baby and you might get better. And I thought, okay. And I was pregnant 3 months after I got married, and it did revert. I mean, I was just really lucky. We know that's actually, not common. It doesn't happen for everyone, but it did happen for me, and I became episodic.
Okay. So your kids were diagnosed, two of your children were diagnosed with migraine, and it's my understanding that one of them is episodic and one of them has chronic migraine. Is that correct?
Yeah, so they kind of reversed. The youngest was diagnosed, she was chronic, and then she went into a CGRP trial, and she was a super responder, got
Oh,
better.
oh,
And
good.
yeah, luckily she was old enough at the time to go into that trial. And then my younger daughter went from episodic to now she's chronic, and I'm also chronic.
Okay.
So when you talk about being in the same boat, it's funny because I sometimes think of my family as, so I've got two boats. I've got, my daughters, there's my three daughters, and then there's three of us that are in that boat with migraine. And my other daughter, who's healthy, who doesn't have migraine, she's sort of in, her own her world, which is fine, which is good.
Yeah. So you mentioned to me once that your mother didn't speak much about migraine. Now, many of us have been through this. I hid my disease for years from everyone. I wasn't a mother yet at that time. But I think that there's many of us, especially back before we had advocacy really for our disease, we hid it. Do you feel it would have been easier for you to become a mother of children with migraine and to understand your own disease if it wasn't hidden? Do you believe we should talk about it?
I think if we don't talk about it, we're never going to get a cure. And I think right now, with all the advances in the nonprofit organizations and key influencers that have come into the headache space, it's been a really great time. This is a moment for migraine. And the only way that we're ever going to see change is we all have to start talking about it.
Right. What are some things, maybe positive things, that you think your family has learned from being a family that copes with migraine, excuse
Yes,
me.
I think that I try to be a role model for my children. And, obviously I wasn't always working at Miles for Migraine. I was just this mom with two kids that were experiencing this condition, this disease. And I think that right now, because there's so many more resources, there's apps for migraine, there's the pediatric registry that I'm lucky to be involved with that will help to bring more research for kids and newer treatments. There's so much education, And I think that I can now offer all this to my children. I can say, look, here is a plethora of information, and you need to pick and choose what works for you. I'm not going to tell you what to do, but if you don't do this, then, don't expect to get better on your own, because it really is a team approach. You can't just, it's hard for parents. I mean, we work, the Miles for Migraine Youth Day Camp is a perfect example of that. I mean, these parents are devastated.
Yes.
They're trying to do everything they can. And, we're offering these educational programs at Miles for Migraine for the families and the teens. And one of the comments that we just got from one of our most recent episodes was that, well, my daughter's already heard all of this. Like, what more can you do? And unfortunately, there's not much more that you can do except offer support and ways of coping with something. It's making lemonade out of lemons.
I would like to point out, though, that you're not giving yourself credit for some of what you've done. You have taken something that has affected your family, and you have helped pretty much a whole nation of people who have this disorder. You have been the key leader in Miles for Migraine. You also are involved in the Pediatric Migraine Registry. So you are one of the advocates who's taken what has affected your family and your children and moved forward and made it better for all of us.
Well, thank you for saying that. I appreciate it. It is something I'm obviously passionate about. And I do think, as a new grandmother, that it's something that hopefully in the future will help to save someone else's grandchild or child. That to have these resources is very important, to get involved and not just sit back and watch your child suffer. You have to be proactive. But you don't have to run an organization. You can just show. There's so many other nonprofits that are doing great work, including the National Headache Foundation. And I think that we were featured as a multi-generational family in the U.S. Pain Foundation Invisible Project, which I love that magazine. I hope your readers will go out and go to their website and ask to have one sent to them. And it really showed how our family, we have come together, and it has actually brought us a little bit closer, because we're sort of all in the same boat, as you said. And it's a way to find something positive that we can do to make change.
Yes. And I think that's so important and so lovely when you can take it and do something positive with it, do something empowering with it, that involves your whole family, and that helps not only your children, but other children in the same situation. So yes, so thank you for that. I just wanted to make sure we pointed out that you have been a great leader in the community for this.
Yeah, and I'm also really lucky to be involved with the Coalition for Headache and Migraine Patients, CHAMP. CHAMP is a great resource, because now we've got all the organizations listed in one hub, and all the great work that we're all doing. If you have a child that is newly diagnosed, or even just have been going on for years, I would say to a parent, if you don't go to that website and check it out and see what you can do, because advocacy needs to be part of the treatment plan for your child, and doctors aren't prescribing advocacy yet, because they're just not. Some are and some aren't. But if you don't do that, then you're really not giving your child every possible opportunity to find even if they just find a connection with another child that's experiencing the same thing they do. We get so much positive feedback from the youth camp work, because it just offers something positive.
Right.
And I also want to mention that CHAMP is doing a Stigma in Schools project, which is really hopefully going to change and to build the platform for bringing migraine into the schools and educating administrators, school nurses, teachers. And, hopefully one day we will have the ability to have the schools diagnose children, because if we can, remember when we were a little kid and you had to go to the nurse and you had to bend over and they checked your spine for scoliosis? That takes 2 seconds. It's something that camps can do and schools can do, and hopefully one day we'll have that.
Yes, that would be amazing. I think that having the schools more educated about migraine would be so important, because I know when I was a child, I would go in on my worst migraine days, and there was a rule with the school nurse where if you didn't have a fever, they wouldn't call your mother.
Mm.
And I had a migraine, I didn't have a fever.
Yeah.
So that was a huge problem for me. It was a big roadblock, being that sick and not having a fever. I didn't fit into their rules. So I think that the more education we can have in the schools about migraine, the better. So I did want to bring up one thing that you mentioned, that you wanted to talk about, and that was, as your children were growing and they had migraine, you felt there was a stigma. It was difficult for you to talk about your kids with people, because there was a stigma, and it was hard for you to explain what was going on in your family. Can you talk about that a little bit?
Oh, wow. I felt so isolated and so alone. I felt like, first of all, I felt like I was the only parent in the world that was experiencing this. I mean, my daughter spent a year in bed in my bedroom in a dark room.
Oh,
Thank God we had a dog. The dog stayed with her the whole time. And when I tried to explain that to people, I explained it to someone who actually was a family member. And she said to me, well, my son goes every day to school. And when he starts to have migraine, he just takes some Tylenol and he just keeps going. And I thought, yeah, but that's not what this is.
yeah.
And she just didn't understand it. Like you have the two schools of thought. Like the doctors are saying, you need to send your daughter to school and she needs to just go and just do what she can. She has to keep going. You can't stop and stay in bed. And then the other school of thought is, yes, but if someone's really debilitated, they deserve to be on disability and they deserve to stay home and they're sick.
Mm-hmm.
So you've got these two camps, and then you've got a whole bunch of people that don't understand, who think it's just a really bad headache, but she was having so many other symptoms besides just head pain. And so, it's almost like you sometimes get a little bit of stigma from the healthcare provider who's saying, well, send her. And the other one's saying, no, don't send her because, she deserves to stay home. And when you hear it from your friends and family who, I thought, I mean, it was horrible. I just wish that, friends would call me more or go out of their way to understand it better.
Mm-hmm.
And I felt like they really didn't. And so that's really what creates the stigma. But I think if you're a parent with a child and if you don't do something yourself to get involved, now that you have all these opportunities that were not around even just 5 years ago, or actually now it's going on, I guess, 8 years since she was diagnosed, then you're doing yourself a disservice and your child, and you're increasing the stigma that's going to continue if you just sit on your hands and do nothing and just worry.
Right. I think that is a great message. And to close, I was hoping that I'm wondering if there's anything that you can tell people that is a positive attribute you feel that your children or your family have gained from having migraine. For example, my children, I feel they're very resilient. I feel like they've learned resilience from watching me overcome my migraine attacks and from overcoming their own migraine attacks. While I do feel they haven't experienced a lot of migraine on their own, they have experienced some, and I do see a lot of resilience in them for helping me overcome my attacks. Is there a particular attribute you feel your family that's positive that your family has learned?
I think my family has learned compassion. I think that when, there's really three of us, right? Myself and my two daughters and my mother. I think that they're so understanding and so loving and caring. Like when I'm having a bad day, they are calling me and texting me and saying, Mom, I'm thinking of you. I hope you're going to feel better soon. And so it's good to know that someone's in your corner and cares about you and isn't also falling apart at the same time. So
Mm.
I think I would just say compassion, and that as young women and even children that are, diagnosed now, we're planting the seeds for future advocates. And so I think that there's a real opportunity and a calling for young people and my daughters to be advocates and get out and speak about it and do whatever you can. And so that I see as a positive, that they're doing something. They're not just, lying in bed,
Right.
waiting to get better, because they may not get better.
Yeah.
And that's okay.
Uh-huh.
We can do what we can do, and hopefully accept what we can do,
Yeah.
and continue to live the best life we can live. That's all we can do.
Mm-hmm. All right. Well, thank you so much, Shirley, for joining us today. And we want to say Happy Mother's Day to all the mothers out there. And just continue to be strong and be awesome advocates for you and for your family, anyone in your family. And thank you so much for joining us this week. And please join us again next week on Heads Up, the weekly podcast and webcast of the National Headache Foundation. Bye-bye.